When it comes to talking about disability, there are multiple ways of understanding what that means. In the previous video, we spoke about how some definitions of disability focus on a person's impairment or condition, while other definitions look at the barriers disabled people face in wider society. There are actually names for these ways of seeing disability: the medical model and the social model. Let's explore these terms more deeply. The medical model of disability focuses on a person's condition or impairment as the reason why they are disabled. For example, if a wheelchair user is unable to access a restaurant when going to a meal with friends, the medical model would say that that person's condition or impairment is the reason why they are unable to access the restaurant. The restaurant owner might think, oh, that's a pity, they're unable to enter the restaurant because they're a wheelchair user, which makes it the disabled person's problem, rather than thinking, oh no, I haven't created an accessible space that allows disabled customers to enter safely. I need to fix that. But I should also mention that the restaurant has a legal obligation to provide access. And this is where the social model comes in. Rather than viewing someone's condition or impairment as the reason why they're disabled, the social model views the barriers created by society as the thing that disables people. That it's these barriers that stop people from being able to participate in society. The social model was created for and by disabled people. This way of thinking encourages everyone to think more deeply about how we can work together to remove these barriers so that everyone can be included. Disableist barriers can be anything from physical to technological, financial, to negative attitudes about disability. It's important to note that not every disabled person interprets disability through the social model. But the social model is designed for us to talk about the barriers that disabled people face. The things that can be changed, not the facts about our conditions if they can't. Thinking about disability in terms of the barriers society and every organisation have created can be a helpful framework when planning events in the cultural sector, and thinking about how we can tackle disableist barriers for guests, visitors, and members of your team. Let's think of some examples. When planning your cultural events, have we thought about the buildings or the spaces your events are taking place in? Are the entryways accessible? Are there suitable ramps? Does the building have a lift? Is the lift actually working? Is there an accessible toilet in the space or a changing places toilet? Knowing the answers to these questions and tackling these barriers allows mobility aid users, people with limited mobility or stamina, to be able to attend your cultural events safely. Are you planning an event that uses visual or audio media? Are there clear and suitable subtitles showing what's been said and what a hearing audience would hear for deaf and hard of hearing people? And is there an audio description for blind people or people with visual impairments to know what's been shown? Providing these breaks down a barrier for deaf, hard of hearing people, blind and visually impaired people to enjoy these elements of your events as well. When promoting your events with social media, do you have written descriptions of the images describing what can be seen? If not, this means you have excluded blind and visually impaired people from knowing about your events on social media. Have you thought about visitors, guests, freelancers, and colleagues who are neurodivergent or who have learning disabilities? Will there be relaxed screenings or performances to allow people with sensory sensitivities to comfortably enjoy the event? Are you providing easy read documents to detail the event information? Are you breaking down instructions related to an event in small, digestible steps? And here's another thing to ask. Are you sharing your access information, both what you have and what you don't have, widely and publicly so disabled people can easily access it rather than having to chase you for it? Tackling barriers when creating cultural events is not a one-size-fits-all situation and can require some creative thinking. Here's a personal example. A few years ago, I took part in a panel which explored disability in art. To break down barriers for immunocompromised people, the event encouraged the use of masks and provided free masks for all attendees. The event had BSL interpreters, but some attendees didn't use BSL, they used lip reading. The solution was to seat guests who used lip reading at the front. Members of the panel would then lower their mask when speaking and raise it back up when not speaking. This allowed people who use lip reading to be able to read their lips. However, in another situation, this might not have worked if an immunocompromised panelist didn't feel comfortable without a mask. In that situation, someone who was unmasked could repeat what was said to the audience. Sometimes you need clever solutions, and you may not be able to accommodate everyone's access needs, but you should still try. It's important to think about the social model of disability and breaking down disability barriers as an ongoing practice. It requires constant listening, learning, collaboration, and flexibility. But when working together on this, the end result is planning exciting cultural events that we can all enjoy and feel included in.